Welcome to the series of Equity and Telehealth Vignettes brought to you by the Delta Center California State Roundtable. Delta Center California is an initiative supported by the California Healthcare Foundation and the Robert Wood Johnson Foundation and led by JSI Research and Training Institute. It brings together behavioral health and primary care leaders to accelerate care improvement and integration through policy and practice change. The ultimate goal of Delta Center California is to cultivate health policy and a care system that is more equitable and better meets the needs of California's individuals and families. One of the ways we have pursued this goal is to lift up the experiences of people who receive care to inform policymakers, payers, and providers striving to create a more equitable care system. When Delta Center California began in March 2020, telehealth was more of a policy and a practice idea than a reality for most of the primary care and behavioral health providers, payers, and clients in Medi-Cal. 3 years later, thanks to the bold steps by the Department of Healthcare Services, the Newsom administration, and rapid implementation among health centers and community behavioral health organizations in the face of the COVID-19 pandemic, telehealth is here to stay. How can we ensure telehealth is effective as a tool for improving access, outcomes, and equity? The 7 vignettes here come from the individuals served by California health centers and community-based behavioral health providers, some of which participated as local grantee teams in the Delta Center California Learning Lab. These stories were selected and elevated by primary care and behavioral health associations serving on the Delta Center California State Roundtable. Each vignette highlights an individual story and an opportunity to advance equity in telehealth. You can watch the vignettes in any order, and we encourage you to watch them all. Each story concludes with an action item, an idea for how you can influence policy and practice. Our hope is that these stories improve the understanding of telehealth experiences of patients and providers and highlight opportunities to promote health equity. Enjoy and share widely.